If you are over 50 and taking a handful of pills every morning, I want you to pause for just 1 second. Because one of the most popular supplements on the market right now, magnesium, could actually be making your health worse, not better. And I'm not talking about a minor side effect. I'm talking about a chain reaction that can quietly damage your kidneys, disrupt your heart rhythm, and even accelerate cognitive decline. But here's the twist. Magnesium is also one of the most critical minerals for your body after 50. The problem is, 99% of people are taking the wrong type, at the wrong dose, at the wrong time of day. Today, I'm going to show you exactly how to know if you need magnesium, which form is safe for your age, and the one simple test you can do right now at home to check if your levels are dangerously low. And at the end of this video, I'll reveal the single biggest mistake people over 60 make when buying magnesium supplements. A mistake that could be silently robbing you of energy and bone strength. So stay with me until the very end. Before we dive into the details, I want to invite you to subscribe to my channel and turn on all notifications. Every week, I share practical, science-backed ways to take control of your health without relying on endless prescriptions. If you hit that subscribe button and the bell icon, you'll never miss a video that could change how you feel. Also, please give this video a thumbs up. It tells the algorithm that this information matters to people like you. Now, let's get started. Let me ask you a question. Have you ever felt that afternoon slump that no amount of coffee can fix? Or woken up with muscle cramps in your calves at 3 in the morning? Maybe you've noticed your heart doing a little flip-flop when you're trying to fall asleep. These are all classic signs of a magnesium deficiency. But here's what most doctors won't tell you. By the time you feel these symptoms, your magnesium levels have likely been low for months or even years. And the standard blood test your doctor orders, it's almost useless for detecting a true deficiency. That's because only about 1% of the magnesium in your body circulates in your blood. The rest is stored in your bones, muscles, and soft tissues. So a normal blood level can give you a false sense of security. Now, why does this matter after 50? Because as we age, our bodies become less efficient at absorbing magnesium from food. Our kidneys start to excrete more of it. And many common medications, like proton pump inhibitors for acid reflux, diuretics for high blood pressure, and even some antibiotics, can strip magnesium out of your system like a thief in the night. The result? A slow, silent depletion that contributes to muscle weakness, poor sleep, insulin resistance, and even an increased risk of falls and fractures. But here's the good news. Your body has an incredible ability to restore balance when given the right support. And magnesium is one of the most powerful tools you have for that. It's involved in over 300 enzymatic reactions in your body, including energy production, nerve function, muscle relaxation, and the regulation of your heartbeat. In fact, magnesium is so critical for heart health that studies have shown that people with higher magnesium levels have a significantly lower risk of sudden cardiac death. So, if magnesium is so important, why am I warning you about taking it? Because the supplement industry is a minefield. Walk into any pharmacy or health food store and you'll see shelves lined with magnesium oxide, magnesium citrate, magnesium glycinate, magnesium malate, magnesium threonate, the list goes on. And most people grab the cheapest bottle, thinking they're doing themselves a favor. But here's the truth. Magnesium oxide, which is the most common and cheapest form, has an absorption rate of only about 4%. That means 96% of what you swallow passes straight through your digestive system, often causing diarrhea, bloating, and cramping. And if you have kidney issues, which become more common after 50, that unabsorbed magnesium can build up to toxic levels without you even realizing it. I want you to write in the comments below, have you ever taken magnesium and felt worse afterwards? Or maybe you've been taking it for years without noticing any difference. Let's see how many of us have had this experience. Your story could help someone else avoid the same mistake. Now, let's talk about the right way to approach magnesium. The first step is not to guess. The second step is not to buy a random bottle. The third step, and this is where most people go wrong, is to understand that your individual needs depend on your diet, your medications, your kidney function, and even your sleep patterns. And I'm going to walk you through each of these factors in just a moment. But before I reveal the number one form of magnesium that I recommend for people over 50, there is one common mistake you must avoid, which I'll share in just 30 seconds. Because if you make this mistake, all the magnesium in the world won't help you, and it could actually put you at risk. So stay with me. The mistake is this: taking magnesium without checking your potassium levels. You see, magnesium and potassium work together like a lock and key. They regulate your heart rhythm, your muscle contractions, and your nerve signals. If your potassium is low, magnesium cannot do its job properly. And if you take high doses of magnesium without addressing a potassium deficiency, you can actually trigger a dangerous heart arrhythmia. This is especially important if you take diuretics for high blood pressure, because many diuretics deplete both magnesium and potassium simultaneously. So before you start any supplement, ask your doctor for a simple blood test that includes both magnesium and potassium. It could save your life. Now let's move forward to the practical steps. I'm going to give you a simple, step-by-step plan that you can start using today. And I promise, you won't need to buy expensive supplements or follow complicated protocols. Just a few small changes that can make a huge difference in how you feel. Step 1. Understand the difference between the forms of magnesium. This is where most people get confused, and I don't blame you. Walk into any pharmacy and you'll see shelves lined with magnesium oxide, magnesium citrate, magnesium glycinate, magnesium malate, magnesium threonate. It's overwhelming. But here's the truth. Not all magnesium is created equal, and choosing the wrong form can be a complete waste of your money. Let me break it down for you simply. Magnesium oxide is the cheapest and most common form you'll find. It's often used in laxatives because it pulls water into your intestines. But here's the problem. Your body absorbs less than 4% of it. That's right, over 96% passes right through you. So, if you're taking magnesium oxide for your heart, your muscles, or your sleep, you're basically flushing your money down the toilet. And worse, it can cause diarrhea, bloating, and cramping. I see so many patients over 50 who complain of stomach issues, and when I ask what supplements they're taking, it's almost always magnesium oxide. So step away from that bottle. Now, magnesium citrate is better absorbed, about 30%. It's still slightly laxative, but it's a good option if you struggle with constipation. However, if your goal is to support your heart, your nerves, or your sleep, there's a much better choice. Magnesium glycinate is my top recommendation for people over 50. Why? Because glycine is an amino acid that calms your brain and promotes deep sleep. When magnesium is bound to glycine, it becomes highly absorbable and gentle on your stomach. It doesn't cause diarrhea. It actually relaxes your muscles and your mind. I have patients who tell me that after switching to magnesium glycinate, they sleep through the night for the first time in years. Their leg cramps disappear. Their anxiety melts away. It's like a natural tranquilizer without the side effects. But there's another form you need to know about if you're concerned about your brain health. Magnesium threonate. This form crosses the blood-brain barrier more effectively than any other. Studies suggest it may improve memory, focus, and even slow cognitive decline. If you're worried about dementia or brain fog, this is the one to consider. It's more expensive, but for some people, it's worth every penny. Now, step 2. Timing matters. When you take magnesium can dramatically affect how well it works. Many people make the mistake of taking it with a large meal, especially one high in calcium or fiber. Calcium and magnesium compete for absorption in your intestines, so if you take them together, you're reducing the amount of magnesium your body can use. The same goes for high-fiber foods like whole grains and beans. They bind to magnesium and carry it out of your body. So here's my advice. Take magnesium on an empty stomach or at least 30 minutes before a meal. And if you take calcium supplements, which many women over 50 do for bone health, take your calcium in the morning and your magnesium at night. This way, they don't interfere with each other and you get the full benefit of both. Step 3. Start low and go slow. This is a principle I cannot emphasize enough. Your body needs time to adjust to magnesium, especially if you've been deficient for years. I recommend starting with just 100 milligrams per day for the first week. Then, if your digestion feels fine, increase to 200 milligrams. After 2 weeks, you can go up to 300 or even 400 milligrams, but never exceed the upper limit of 420 milligrams for men and 320 for women without medical supervision. Watch for signs that you've taken too much: loose stools, nausea, or a drop in blood pressure. If you notice any of these, simply reduce your dose. Your body will tell you what it needs. And here's a bonus tip that most doctors don't share. Magnesium works best when you combine it with vitamin B6. Vitamin B6 helps transport magnesium into your cells, making it more effective for energy production, nerve function, and hormone balance. I recommend taking a B-complex supplement or eating foods rich in B6, like bananas, poultry, and potatoes. It's a simple synergy that amplifies the benefits without any extra cost. Now, let me address a question I hear all the time. Can I get enough magnesium from food alone? The honest answer is, it's difficult, but possible. The best food sources are dark leafy greens like spinach and kale, pumpkin seeds, almonds, black beans, and avocado. But here's the catch. The magnesium content in our soil has declined dramatically over the past century due to industrial farming. So even if you eat a perfect diet, you may still be falling short. That's why I believe a targeted supplement is a smart insurance policy for most people over 50. But if you prefer to get it from food, aim for at least 2 servings of leafy greens per day, plus a handful of nuts or seeds. And remember, cooking can reduce magnesium content, so eat some of your vegetables raw or lightly steamed. Before I reveal the next step, I want to share a quick story about one of my patients. Her name is Margaret, she's 68 years old, and she came to me complaining of severe leg cramps that kept her awake every night. She had tried everything: stretching, heating pads, even prescription muscle relaxants, but nothing worked. I tested her magnesium levels and they were dangerously low. I put her on 200 milligrams of magnesium glycinate before bed. Within 3 days, her cramps stopped completely. She called me crying, saying she hadn't slept that well in years. That's the power of getting the right form, the right dose, and the right timing. Margaret is now a believer, and she shares her story with everyone she meets. If you're finding this helpful and want to take control of your health the easy way, make sure to subscribe to this channel. Every week, I share new practical tips and home remedies for vitality. Join our community now by clicking the subscribe button below. And now, let's move on to the most common mistakes people make when taking magnesium. Mistakes that can render it useless or even dangerous. Mistake number 1. Taking the wrong form of magnesium. This is the most common error I see in my practice. People walk into the pharmacy, see a bottle labeled magnesium, and assume it's all the same. It's not. Magnesium oxide, for example, is cheap and widely available, but your body absorbs less than 4% of it. That means you're essentially swallowing chalk. It can cause loose stools without delivering any real benefit. If you're taking magnesium for cramps, sleep, or heart health, you need a highly absorbable form like magnesium glycinate, magnesium citrate, or magnesium malate. Glycinate is my top choice for relaxation and sleep. Citrate is excellent for digestion. Malate is ideal for energy and muscle pain. Choose the wrong one and you might as well flush your money down the toilet. Mistake number 2. Taking it with the wrong foods or medications. Magnesium absorption can be blocked by calcium, high doses of zinc, and certain foods like bran, whole grains, and legumes that contain phytates. If you take your magnesium with a bowl of oatmeal and a glass of milk, you're dramatically reducing how much actually enters your bloodstream. The best time to take magnesium is on an empty stomach, at least 1 hour before or 2 hours after a meal. And if you're on thyroid medication, blood thinners, or certain antibiotics, magnesium can interfere. Always space it at least 4 hours apart from these drugs. Talk to your doctor before starting, especially if you have kidney disease. Mistake number 3. Taking too much too fast. I understand the urge. You want results, so you think more is better. But magnesium works best when you start low and go slow. Begin with 100 milligrams per day for a week. If your digestion tolerates it, increase to 200. If you develop loose stools, you've reached your personal limit. Back off by 50 milligrams. The goal is therapeutic benefit without digestive upset. Your body will tell you the right dose. Mistake number 4. Ignoring the timing. Magnesium is not a morning stimulant. It's a nighttime relaxant. Taking it in the morning can make you feel sluggish and drowsy. The ideal window is 30 to 60 minutes before bed. This aligns with your body's natural circadian rhythm and enhances deep sleep. Pair it with a warm bed, dim lights, and no screens, and you'll amplify the effect dramatically. Mistake number 5. Expecting instant results. Magnesium is not a drug. It doesn't work like ibuprofen. It works slowly, rebuilding your cellular energy systems over weeks and months. Most people notice improvements in sleep and muscle cramps within 3 to 7 days, but full benefits for blood pressure, anxiety, and heart rhythm can take 4 to 6 weeks. Be patient. Consistency matters more than those. Now, here's a bonus tip that few doctors share. Magnesium works synergistically with vitamin B6 and taurine. B6 helps transport magnesium into your cells. Taurine stabilizes your heart rhythm and enhances magnesium's calming effect. If you can find a supplement that combines these three, you're getting a powerful trifecta for heart health, sleep, and nerve function. I personally recommend this combination to my patients over 50. But pay close attention, because the next mistake is the most dangerous of all. Mistake number 6. Taking magnesium if you have undiagnosed kidney disease. Your kidneys are responsible for filtering excess magnesium out of your blood. If they're not working properly, magnesium can build up to toxic levels, causing dangerously low blood pressure, irregular heartbeat, and even cardiac arrest. If you have diabetes, high blood pressure, or a family history of kidney problems, get your kidney function tested before starting magnesium. A simple blood test called EGFR will tell you if it's safe. Do not skip this step. It could save your life. Now let's talk about the signs that your magnesium levels are actually improving. You'll notice fewer muscle twitches and cramps. Your sleep will become deeper and more restorative. You'll wake up feeling less groggy. Your digestion will become more regular, not loose but comfortable. Your heart palpitations may decrease. And perhaps most importantly, your anxiety levels will drop. Magnesium is nature's original tranquilizer. It works on your GABA receptors, the same ones targeted by prescription anti-anxiety medications, but without the side effects or addiction risk. But here's the thing most people get wrong. They think taking more magnesium will give them faster results. That's mistake number 7, megadosing. More is not better with magnesium. Your body can only absorb so much at once. Taking huge doses doesn't speed up recovery. It just gives you diarrhea, stomach cramps, and nausea. The maximum daily dose from supplements should not exceed 350 milligrams of elemental magnesium. Anything above that is waste or worse, it's harmful. Stick to the recommended dose. Your body will thank you. Mistake number 8. Taking magnesium with calcium in the wrong ratio. Many people over 50 take calcium supplements for bone health, but calcium and magnesium compete for absorption. If you take them together in equal amounts, magnesium loses. The ideal ratio is 2 parts calcium to 1 part magnesium. But if you are already eating dairy, leafy greens, or fortified foods, you may not need extra calcium at all. In fact, too much calcium without enough magnesium can cause muscle tension, constipation, and even arterial calcification. So if you take both, take them at different times of day. Calcium in the morning, magnesium at night. This simple timing trick makes both minerals work better. Now, let me share something most doctors won't tell you. The best way to take magnesium is not on an empty stomach. Take it with a small amount of food, a few nuts, a piece of fruit, or a cracker. Food helps buffer the stomach and improves absorption, but avoid taking it with high-fiber meals or whole grains. Fiber binds to magnesium and pulls it out of your body before it can be absorbed. So if you're eating a big bowl of oatmeal or a salad, wait an hour before taking your magnesium. I also want to warn you about a hidden danger. Some magnesium supplements contain fillers like titanium dioxide, magnesium stearate, and artificial colors. These additives can irritate your gut and reduce absorption. Look for supplements that are third-party tested. Brands that display a USP or NSF seal have been verified for purity and potency. Don't trust a pretty label. Trust the testing. And here's the final tip that will save you money. You don't need expensive, fancy magnesium blends. The most researched and effective form is magnesium glycinate. It's gentle on the stomach, highly absorbable, and it crosses the blood-brain barrier easily, which means it works for sleep, anxiety, and muscle relaxation. Magnesium citrate is cheaper, but can cause loose stools. Magnesium oxide is poorly absorbed, avoid it. Magnesium malate is good for energy and muscle pain. But for most people over 50, glycinate is the gold standard. In the final part of this series, I'll reveal the one magnesium mistake that could send you to the emergency room and how to avoid it. Plus, I'll show you the exact morning routine that maximizes magnesium absorption all day long. You won't want to miss it. Now, let me address the biggest question I get asked in my clinic every single day. How much magnesium do you actually need? The recommended daily allowance for women over 50 is 320 milligrams, and for men, 420 milligrams. But here's the truth most doctors won't tell you. These numbers are the bare minimum to prevent deficiency, not to optimize your health. If you're dealing with chronic stress, poor sleep, muscle cramps, or constipation, you may need more. I typically recommend starting with 200 to 400 milligrams of elemental magnesium from glycinate each evening. But don't just guess. Pay attention to your body. If your stools become loose, you've taken too much. If your sleep improves and your muscles relax, you've found your sweet spot. Before I wrap up, I want to share one simple test you can do right now. Press your thumbnail into the fleshy part of your opposite palm. If you feel a sharp pain or your nail leaves a deep indent that stays for more than a few seconds, your magnesium levels may be critically low. This is called the Trousseau sign, and it's a reliable indicator of deficiency. If you see that, it's time to take action. Share this video with someone you love. Send them the link so they can learn about this simple mineral that could change their life. And remember, all advice is for informational purposes only. Always consult your physician before starting any new supplement. I'm Dr. Sarah Carter. Take care of yourselves.